Hi, and welcome to Module 2 of the Peer Mentor Training. My name is Karen, and I will be presenting Module 2, which will provide an overview of the study and your role as a peer mentor. As a peer mentor, you are part of a team that consists of the site investigator, a site research coordinator, yourself, and your mentee. Your role specifically is to conduct weekly check-ins with the mentees you are assigned to and offer them support to start taking the hepatitis C medication, maintain adherence to the medication, and to promote harm reduction behaviors so they don't get reinfected. In Module 5, you'll learn some communication skills that will guide these check-ins. Take a minute now to think about what you think a peer mentor is and whether you've been mentored by someone else. What are some of the characteristics or qualities that you think make a good mentor? Check off the ones that you think describe who you are. As stated previously, your role is very important. You will be checking in weekly with your mentee by phone or video chat. You will check in with them as they are taking the medication, but it's also as important to contact your mentee after treatment to keep them engaged in care. This is how we will know if the treatment worked. The figure on this slide depicts the schedule for your check-ins. The first check-in will be on a video call with the mentee after they enroll into the program and while they're still at the treatment center. During this call or chat, you will introduce yourself and set up the check-in schedule with them. The phase after the check-in is called the pre-initiation stage, shown here in orange. This is the time when your mentee will be having tests done and meeting with a doctor to see if they can take the medication. During the pre-initiation stage, your role will be to support them in going to all the visits and lab requirements, and if eligible to start taking the medication, picking up the medication from the treatment center. Examples of things that you can do during the pre-initiation stage include reminding them to go to the lab or pick up the medications. Throughout the schedule, you should also ask them about practicing harm reduction behaviors so they don't get reinfected, things like not to share razors, toothbrushes, and equipment for drug use. So once they start taking the medication, you will continue to check in with them for 8 weeks, which is how long they will take the medication. This is the phase we call post-initiation, which is shown here in purple. The focus of these check-ins are to support the mentee with taking the medication every day as directed. This is also referred to as adherence. For program participants not taking their medicine, the focus of the check-ins will be to encourage them to restart taking the medication. In Module 5, we will go into more detail about the check-in structure to guide you. During the entire 8 weeks of them taking the medication and the 12 weeks after, you should also be providing support and encouragement to practice harm reduction and so that they can prevent reinfection. Finally, in the phase depicted here in green, the post-treatment clinic visits, your job will be to support them in reminding them to attend the final clinic visits, the study-specific appointments. This will be when tests will be done to make sure that they have been cured. This slide provides some facts about the hepatitis C medication that you can share with your mentee to increase their motivation for starting and adhering to it. Some people don't know that medications have been developed that can actually cure you of hepatitis C. Some people may have had experience with medications in the past, such as interferon, that had very low success rates and a lot of side effects. This medication involved in this program has been shown to cure people in 8 weeks. Once cured, the liver can start regenerating new healthy tissue. For each mentee that you are assigned, you will be given a booklet of tracking sheets so that you can document the date of the check-ins each week and how it went. The tracking sheets will be shared with the research coordinators so that they can support you and also to track payments for the check-ins. On this slide, you can see examples of the check-in sheets. For each week, you will write down information for each attempt. You will be given a tracking sheet for both pre-initiation phase and then post-initiation phase once your mentee starts taking the medication. We will also be going over the tracking sheet in detail in a video in the next slide. After watching these modules, you will practice check-ins with the research coordinator. We also encourage you to role play with the other peer mentor on your team. What's really important for you to remember is that becoming a peer mentor is a process, and the more you practice, the more comfortable you'll feel. Your peer mentor manual is an important resource that you should have handy when you have your check-ins. There's a section that provides answers to frequently asked questions and reminds you about the check-in structure for the weekly check-ins, as well as how to manage your self-care and disclosures and confidentiality.